first on the agenda is Glenn Porter. And Glenn, if you would do me a favor and sit in that chair, then the people at home would be able to hear you better.
Of course.
Hot seat.
I'll take it, no problem. And I'm on Gateway Street. I left that out, sorry. All right, so, I got invited to the meeting from one of our committee meetings that we have over at the Navigation Center. And I definitely want to take an opportunity to, kind of explain what we're doing over at the Nav Center and, provide you guys with an opportunity to ask questions, voice concerns, that way I can go over some of the stuff that I'm working towards, what our trajectory is, and how we're looking to resolve, the homeless crisis that we have going on here. All right, so basically we are the Navigation Center over on River Road, or River Avenue. We are a 75-bed shelter that we serve chronically homeless adults. We provide housing, room and board, and some of our main goals is not just getting these individuals off the streets, but getting them linked to long-term housing and getting them linked to the proper services that they need, so they can go back to being self-sufficient individuals, part of the community. And so they're not, no longer casted out, because some of the evidence that I've seen is it's easier to get individuals into housing. It's more hard to help them keep that housing. And I think coming up here, I've made the commitment to actually move up here fully from San Diego, California, to get boots on the ground, to be fully invested in this. One of the things I definitely did want to voice out, and I told this to PK last time, that me coming up here was, it was a choice. It wasn't a job transfer or anything like that. Like, I wanted to come up here and be part of it. I wanted to get involved in the community. It started off, I came up in, the late part of January, was my first visit, and I came up here and did an assessment on the program, offered to provide some support for a week, and fell in love with the community, fell in love with the neighborhood, obviously the mountains, that lovely winter weather you guys got going on. It probably sounds weird coming from San Diego, where we quote unquote got the weather we have, but I wanted to come up here and get an experience of these 4 seasons. And one of the things that I'm big on is I've seen outside providers try to work, have impact in the community, but not really be part of the community. So my commitment to actually moving up here, because it was like a 3.5, 4 month process of me trying to find an apartment. And we found one a few weeks ago, and so I finally moved my whole family up here, and the wife and my 2 daughters. So it was a full-fledged commitment on, jumping in despite with you guys. So before I went, I did pull some data and some stats for you guys to go over, so you guys can see where we are, see where we're going, and see who we serve, and put a better understanding on what we're doing over there. So starting off, since we've opened up in September, we've served a total of 177 individuals. And so that's, when we say serve, that means we kept them off the streets for at least one night, where they stayed in the program for a week, 2 weeks at a time. We literally served 107 individuals that we kept off the street. Out of those 177 individuals, we've identified that we served 11 veterans. We're big on recognizing veteran services and stuff like that. One of the gaps that I found was linkage to veteran resources, or even some of our population that we serve aren't familiar with the veteran resources that are out there. So I brought that number up because I definitely want to highlight that number, because there's a lot more veterans in the community that aren't aware of the services, nor are they being recognized as veterans that serve this country. Some of the census of those 177 individuals we served, 100 are males, 70 females, and then we have 7 that are in between, whether they're non-gender identities, transgenders, and things of that nature. But some of the key factors that I wanted to point out to you guys is, out of those 177 individuals that we served, 140 of them have diagnosed mental health conditions that we've been able to not assess and identify on our own, but because we've been able to get them linked to medical coverage and stuff like that, they've been able to go get their diagnosis recognized and actually start working towards treatment on those diagnoses. I like to point out that number because a lot of the times, homeless population, they do have that stigma, that stereotype that they're homeless because they're drug addicts, they're homeless because they want to be. When one of my main key factors was recognizing where the gap is in service on what's going on, and there's a huge gap in the linkage to mental health services. So just so you guys know, on your radar, one of my priorities over the next 3 months or so is actually ramping up some of the mental health services that we're able to provide on site, meaning they won't have to leave to go get that mental health services. They won't have to leave to go to their groups. They won't have to leave to get that treatment. We want to make the NAP Center a one-stop shop where they get the referral, they come in off the streets, and we start getting back in shape from day one. That starts at, you know, looking for IDs, social security cards, birth certificates, helping them get linked to their social security benefits and things of that nature, so they can actually be self-sufficient and self-sustained and not be, you know, wholeheartedly dependent on, you know, the government assistance and things of that nature. Of that population we serve, 120 of them have reported a chronic health condition. 48 of those individuals have reported developmental disabilities. And a couple other ones we have, 117 of those individuals actually came from the streets. They were actually sleeping in encampments, on the bridges, in tents, in riverbeds and stuff like that. And about 49 to 50 of them came from other shelters or other facilities that either they were exited out of because of behavioral reasons, or that facility just couldn't match their level of care or their need of care. So obviously, you know, we have open door policy, we're low barrier. And for those of you know, low barrier means we have very minimal restrictions on why you wouldn't be able to get into the shelter. Meaning, you know, we don't require you to be sober. We don't require you to be getting mental health treatment. We don't require you to be not engaged with some of the activities that you're doing in the street. You know, being part of a harm reduction approach is we're trying to reduce that harm, but putting up that barrier by not letting you in because you got those things going on just doesn't do nothing but continuously create that revolving door. Let's see, a couple of other ones I have. Of the one of the things I did want to point out, of our population that we're serving, we have an average income of about $500 to $1,000. So when I see some of the lack of links to long-term housing, I'm also noticing the gap in the income, meaning a lot of these individuals have fixed incomes because about, what's the number? I want to say about 40% of our population that we serve there is over 55 years of age. So this is a lot of individuals that don't have the ability to go back to work and stuff of that nature. So it's really big for us to get them linked to their social security benefits and their medical coverage, so that way they can obviously live a longer quality life, but actually increase their income. Because a lot of our individuals come in with zero income, and you know they're on, you know, obviously the EBT, the SNAP, and stuff like that. So we're pretty diligent at working towards getting them linked to their medical coverage, so they can get their disabilities diagnosed, so that way they can have proof of disability, so they can get their social security benefits, whether it's the social security retirement or, you know, the disability benefits. And then with that being said, I'm just throwing out numbers out there to you guys. I want to close this up and just literally just be able to take questions from you guys on, you know, if you want to know what we're doing, how we're doing it, what our plans are, how we're addressing and stuff like that.
How many people have gone from the Navigation Center into more permanent housing?
About, right now we're at about 20. So the way it's measured in different categories. So they break it up into either long-term housing, positive exits. Let me see, break that down. So out of those 177 people we've had, out of all the 100 exits of total, we've had 23 of them go to long-term housing. Meaning they're going to their own housing where they're paying rent, with a rental subsidy, or it's just long-term housing. One of the things that we do to focus on, we actually do 6-month and 12-month follow-up calls. So we actually work towards making sure they're retaining their housing. So if somebody that's exited, we call them at the 6-month mark. Hey, how you doing? You still housed? What's going on? If they're not housed, we'll tell them, you know, go get another front door assessment and try to link them to the resources that they need to. So about 20, so right now we're at about 26% of our population that we exit out go to long-term housing. Our goal is 30%, but you know, as we're identifying these gaps in certain types of services, we're able to see that number actually increase more and more. 48 of those individuals were exited to temporary destinations, and that's either meaning another shelter, another facility, another treatment facility, and things of that nature. 14 of them actually transitioned into institutional settings, and that ranges from boarding cares, skilled nursing facilities, actual detox drug treatment facilities and things of that nature. And then we had about 15 that transitioned to other places, whether they exited and went back to the streets, or they just went to some kind of short-term option that they chose to do, or we didn't actually have an exit interview, like they just abandoned their bed. So right now we're at about 25, 26%. The goal is to keep it at 30% and ongoing, but continuously keeping it up like that.
I have two parts. Can you maybe explain to us here, maybe the interaction you have with Brooklyn Street? And
Oh, yes.
here, and then also speak a little bit more about your staff and the interactions that your staff have with the clients there. That was one of the really things that I appreciate about the team, and I think if you tell a little bit more, it would be help us.
Oh, yeah, absolutely. I did forget to mention our Brooklyn site. So we do have another 12-bed shelter over on Brooklyn Street, which if I'm not mistaken, it's literally on the cusp of Springfield and Eugene.
Frank Glenwood area.
Yeah,
Mhm.
and I know there's like,
Right behind Green, kind of.
yeah, it's like right off the freeway area. And with that, so that site, we have a 12-bed facility where we actually, that's our facility that's more geared toward our senior population. 65 and up, 55 and up with vulnerable conditions. They're a little more vulnerable in the congregate shelter setting. It's a bit much for some of our older populations, so we kind of make it to where individuals that fit that criteria, we'll have them over there. We still have the same goals, working towards long-term housing, income, and medical. It's just that setting is a little bit more stable setting. It's a little bit more non-congregate versus just an open congregate setting. What PK was talking about in regards to the interaction we have with our.
Also, the big important part too is that big kitchen.
Oh, yeah, that's where we have our commercial kitchen over there. So we do serve 3 meals at both sites, but over there where we do our commercial kitchen size kitchen, and our chef actually cooks there and then brings the food over here each day. So we do serve 3 full hot meals every day, quality meals. And I take a sense of pride in saying that, because we don't serve something we wouldn't eat. That's one of my rules that I implemented. It's not an official policy, but it's a human nature policy. You know, don't give somebody something you wouldn't eat. And that kind of segues into some of the stuff that I have with my staff in regards to how we engage and interact with our participants. I'm really big on human decency. I treat the janitor the same way I'm going to treat the president or the CEO of a company. And I mean that in the sense of, that's the same way my staff is with our participants. We're extremely engaging in the sense of, I don't allow them, I don't want to say allow them like it's a authoritative type deal, but I don't allow my staff to actually walk by participants in the program without engaging with them, acknowledging them. Even if a participant's walking with their head down, just, hey, how we doing today, Kate? No, screw you. Fine, I'm gonna ask you how you're doing again tomorrow. You know, we're actually creating that culture of a sense of belonging, a sense of pride, and a sense of we're gonna actually meet you where you're at by providing ACT case management, which is assertive community treatment, meaning we go with the harm reduction approach. So if I know this individual has an addiction to, you know, whatever substance, whether it's fentanyl, meth, or alcohol, my staff is trauma informed. So we know saying, hey, you need to put that bottle down, stop drinking. That can cause more damage than good doing. So instead of saying, oh, stop drinking that gallon of vodka a week, let's cut it down to a pint. Let's cut it down to this. We try to tailor them off of that. And, we use that trauma-informed approach, motivational interviewing, and we're big on de-escalation tactics. I'm actually continuing my certification for a nonviolent crisis intervention. So that way we're able to, and my team is able to talk individuals down, do a lot more de-escalating, which overall I think is going to help in the bigger picture with the relationship that we're developing with the PD. What that does is it reduces the amount of PD calls that come to the building, to where a lot of those issues we're able to resolve internally by just talking someone down, by actually creating that rapport to where it's like, hey, let's take a walk, let's cool off, because calling PD is not going to do nothing but create more recidivism. They're going to get tired of coming to the center. Then when they come to the center, they're going to come with a different energy versus that supportive energy. And so we're extremely mindful of that because we want it to be a partnership, a welcoming partnership, versus, they come looking for somebody. It's like, oh, you can't come in here. We're not allowed to report there. No, we want to make sure that it's an open door for both parties.
So, are you in the old veterans building?
Yes, sir.
Okay, I'm just curious where I'm from.
Yeah, so what I found out, we are the old veterans building over here. They came in and did some great remodeling. We got it all patched up, cleaned up. And, if you guys are open to coming and taking a tour, just, let myself know, and we can definitely get it arranged for you guys. We're actually going to be doing a 1-year ceremony, looking at August, maybe September. And, we definitely want to invite everybody out and have like an open house so you guys can see some of the changes we've made and and see what our trajectory is and what we're trying to go and get to. Yes, ma'am.
Two questions. It looks like a great facility. We were able to tour it. Both of us were able to tour it earlier this year, when it was first opened. One of the questions at the time was, where were you getting food from? Was it food for Lane County? Were there private citizens that were making?
So that's,
donations?
so I'm glad you actually brought that up, because one of the things that I did want to start, I don't want to say educating people on, but just giving a little bit more thorough background in regards to, I know one of the big concerns was that we're a corporation and by the letter of the law, we're a for-profit agency. You know, so I know it's a stigma of like, okay, you guys are profiting off of the demise and the misfortunes of the population. If anybody's, you know, familiar with business and the business side of things, the profit that we generate makes it to where we have a line item to buy food. Like that's our profit margin. So with a lot of nonprofit entities, they'll have to get the donations and they're really dependent on that. Beneficial of us being a for-profit, like our profit margin goes back into what we do. So we don't actually, that profit margin doesn't create, oh, you know, the executives are making higher salaries and, you know, big stuff like that. No, that actually goes back into the services we're able to provide. So we're able to provide more adequate meals. We're able to actually, so to answer your question, we actually have a itemized line on our budget to purchase food. Yeah, so we actually go purchase food. We have a vendor, we use US Foods. We get a couple of deliveries every 2 weeks, and so we're able to provide those full adequate meals for individuals.
And is there anything that you need from the community?
For the most part, just support, you know, just support, and for you guys to know that I'm fully aware of what a program or something like this could bring to a community, and I'm extremely diligent on when you drive by there, you don't know it's a shelter, you don't know it's a center, you know, to the point to where I want to say about 2.5, 3 weeks ago, one of my visits, when I was still coming out here once a month to visit, we actually did a block, we did a block cleanup, just randomly, got some trash bags and gloves. We just went out and just picked up trash, not in front of our facility, along the whole street. And we knocked on a few neighbors' doors, obviously getting permission to walk on their property and whatnot. We're just introducing ourselves, saying, hey, we're just here to introduce you. See us walking on their property, so we're picking up and cleaning up trash. And I met with a couple of business owners by giving them a face and a number to tie to the program, to where they have direct access to me, to where they can actually say, hey, we're concerned about this, this is going on, or you guys are doing great. But now there's, you know, direct contact to us to voice anything that you guys have to say. Yes, sir.
I'm kind of excited about this program, and the fact that I'm able to be on the committee is kind of an honor, great. And that committee has somebody from Saco, somebody from River Road. There's a couple of businessmen out of the area there. The donut shop, Warren is from the donut shop, and then the car wash guy is there, and he's on the committee. And we have one of the fellows from the NAS Center, one of our participants is on there. So it's really an interesting conversation, and recognizing that we've only been going since September. You know, we haven't been going a long time. And Glenn didn't tell you about all of his background, but as you can tell, this is not his first rodeo. He's been there before in a lot bigger areas than this, you know, and so it's kind of exciting for me to see the opportunities for the business community, because there are going to be folks there at the center that'll be able to go out and maybe find a part-time job for 4 hours a day or something like that, or maybe 20 hours a week. I don't know. But if we can, in the community, you know, reach out to them and see how we can help them, because I loved your question, what can we do for you? And the other thing is, there may be some opportunities for volunteering to give them assistance in different ways. And but I gotta admit that when I walk in there, it's organized, it's squared away. It's something that you can be proud of. And they're doing a heck of a job.
And I appreciate that. That's one of the biggest points there. Even when I got invited to, you know, when you said, hey, can you come speak at this? I was like, absolutely. Like that's a no-brainer. one of the things, and even when you were talking about some of my experience, so I'm coming on about 10 years working in social services, serving the homeless population from out of San Diego, where you guys know it's bonkers down there. It's like, trying to patch up a leak with wet cement. As soon as we get this covered up, it's overpouring. So, some of the experiences that I've had down there, bringing them up here, I think we're able to make a strong impact. As you know, and I've taken over the program late January. I think we've already been able to see, a big 180 in regards to, I take a sense of pride when you say, I come in there and it looks organized, it looks structured, because that's our goal. I don't want it to be I want to say it being nice. I don't want it to be a dumping ground. And that doesn't mean we're turning people away, but that means we're literally setting the tone for an individual the moment they walk through that door, that you're part of the program. You're not in a halfway house, you're not in a sober living, you're not institutionalized. You're a human, you're part of the program. So as much as you put in, you can get out 5 times as much, and just helping them recognize that, to where I got a round of applause today because I swapped out one of the TVs in the common area that works now, so they're able to watch the game. And just hear someone being like, just that bit of human luxury of, watching a live event that's going on. I didn't recognize that some of the Denver fans out here, but I thought it was pretty cool. But no, I definitely do take a sense of pride in the way we look, the way we do things and operate, because I've seen rundown shelters, and the culture that you set in there is the culture that they bring out into the community. So now we have it to where we might have somebody that's not part of our program hanging out in the alley or across the street at the bus stop doing some inappropriate stuff. And our participants are coming there and be like, hey, there's guys across the street, there's somebody across the street doing A, B, and C. And so, me and myself and my staff will go out there, engage with the individual and, ask them, do you need an assessment? Do you need a resource? Do you need a phone number to call to get help? Or for the most part, you can't be right here. And, we'll get them out of there appropriately, not mean, hey, you gotta go, but no, go, I go out there myself as a project director, and I'm talking to these individuals, I'm engaging with them. And I do that because I need my staff to know that I would never ask them to do something I won't do. So when it came to going out there picking up trash, I'm doing it. When it comes to, if I hear some yelling or commotion in there, I'm going to investigate what's going on and actually resolving it to where the participants actually have that sense of pride in the facility of like, hey, let's keep this clean. Hey, you guys shouldn't be doing that. Like it's turning into a self-governing type of entity, which is a good goal to get to, because now it's changing their level, their stage of change. So before they were really ambivalent to change, I'm just in the shelter to be off the streets. Now I'm in this shelter to get my life together, to bounce back and stuff like that.
Did you explain real quick the how people get into the program? It's not just come knock on your door.
Yes, so that's one of the things that I was pretty excited about in regards to when we set it up. We're not a drop-in center, so people can't just walk up and knock on our door and just walk right in. That does create a system and a protocol for individuals to get into where it avoids us having individuals that are just lingering outside the building and stuff like that. So in order for somebody to get an assessment, they have to get what's called a front door assessment, or VI-SPDAT, which is it's basically they'll meet with an outreach worker, and they're going to go over their needs, their strengths, and their vulnerabilities, and see what's going on. They're going to get their length of history of homelessness and stuff like that. And they're going to get an overall assessment, and then they're going to get their information put into a referral queue, which is the Homeless Management Information System. And then that queue is going to generate a referral to us saying, hey, we have a person that's eligible, that's ready for this bed. And so when that referral comes into the queue in real time, I actually have a team, my staff actually goes on the list, and we start calling those individuals. Say, hey, we got a bed for you. Hey, we got a bed for you. Ready to come get it? And we'll actually arrange the appointment for them to come to the facility to actually do their intake. And we're actually fortunate enough to where now we're going to be able to actually go out ourselves and get that individual. So if it's a person that might have had a phone 5 months ago when they actually did their referral and their assessment, but now we just know they're over, I'm trying to get familiar with some of the errors, but we know they hang out at Alton Park. My outreach team, we're going to the park to look for that individual. Like we're going boots on the ground to find that individual to get them into the program. At that time, tense we are in regards to getting folks off the streets, the ones that want to get off the streets. We're making the point to where we're going to meet you where you're at. And a lot of times, that's not what happens in this realm, the social services. We don't meet them where they're at. You know, oh, no, you need to come to your appointment, you need to be here at 10 o'clock. So we've done things like removing those type of barriers to where, let's say a PK has a referral to come to us, you know. We're not gonna say, PK, your appointment's at 10 o'clock, you're late, you're not gonna get in. Nope. You got 4 or 5 hour window to get here. You get here a little late, we can't squeeze you into your referral because of staffing wise. We're gonna do it the next day. Where you're gonna be at, we'll come find you. That type of deal. That's how committed we are to making sure we're engaging and linking these individuals to services to where some individuals don't want to come in right away, you know, and we might have to go out there and meet with them once a week for 2 or 3 months. We're gonna do that. We're gonna be out there meeting, we're gonna provide that case management while they're out there, where they're at, so we can get them missing to come in. Yes, sir.
You mentioned about a budget, I'd like you to talk about the funding, where your funding comes from, and how large.
No, I'm just kidding. No, our funding does come from different entities in regards to the city and the state. I think PK can definitely give a little more description on our funding, but it generally comes from the county. And then you're asking about our staffing.
Yeah, how large of a staff do you have, and,
Right now, I have a staff of about 28, 5 supervisors, 6 housing navigators, and then the rest are frontline staff and admin staff. When I say frontline staff, those are like site coordinators that you'll see them running around the building a lot, doing a lot of the day-to-day needs of like, hey, I need shampoo, I need soap, I need this or that. And then we also have my housing navigator / case management team that actually set up the goals and help the participants work towards those goals with weekly meetings and stuff like that. We're fortunate enough to where we're going to actually have we hired peer support specialists. Peer support specialists are a different position. They're not case managers. They actually provide that extra layer of support. So these are individuals that are going to go to your appointments with you, go to your meetings with you. They're going to actually walk you through a situation. If you're elevated, you're having a manic episode, these are the staff that are going to actually come on, let's take a walk. They're going to actually remove that person, and they're actually trained and certified to do specifically that, like not working on goals and actually case management. They're there to provide that extra support for an individual. So that way it reduces the 911 calls, hospital visits, EMT visits, calls to cahoots, crisis intervention visits, stuff like that. So we're actually able to keep a lot of that stuff in-house and actually take care of it in-house. Yes, ma'am.
Do you ever utilize life coaches?
Those are similar to what our peer support specialists do. So the good thing about peer support specialists is they have to have a certain amount of lived experience. So they actually have that lived experience and experience with this population. So they can actually have those relationships with our participants that a case manager wouldn't be able to have. So they still have those enforced boundaries, but they're able to have a more personal relationship with the individual because they're able to relate a little bit more because of their past and things of that nature. But yes, we have something similar to that.
And one of the things I found it really interesting is some of the small things you don't think are important, but are important to your participants, your staff and whatnot in the program, and you're implementing it. You're listening, go, well, that's something that we could do. That's something that's doable. Storage. People have stuff and they're scared that their stuff's gonna be gone, right? So they have a place that you put your stuff. Now they need some more, so you get a little more storage. Then you have a safe space to have that.
Even where you're going with that, PK, that's a huge thing that I got so much stuff going on there. But even like what PK is saying, so how would us providing storage impact your community, your neighborhood? That person that has that encampment, they're not leaving that stuff behind for you guys to have to clean up. That means we're gonna actually have somewhere for them to bag up, box up their stuff, and they're gonna be able to bring it with them and store it. So now we're not gonna leave that rummaging of stuff that's behind, this building, that side, or to where now we're having to send out city resources to clean it up, or it's just gonna sit out there for weeks on end and create more of an eyesore and stuff of that nature and making it more dangerous. We're actually gonna make sure that we actually have that additional storage. Inside, we have the Connex box, and then we also did some purchasing. We're actually gonna be doing some more fencing to actually create more storage space for these individuals, which I'm glad PK brought that up, because that's a huge, a huge thing, because we look at driving some of these encampments, we see, they have a bunch of junk, they have a bunch of this. These are stuff that they have, I've had individuals that have heirlooms in there, they have old pictures of old family members. They have stuff that they've held on to that's sacred to them. This is stuff that they've accumulated or saved since the last time they've had a safe space to live. This is stuff, some of the stuff they had in the house 10, 15 years ago. So I think, you know, us providing that additional storage is removing that barrier of saying, I'm not going there because I have to get rid of this. But saying, we respect your property. We might not know what it is. We might not know the value of it, but we respect it enough to where if that means something to you, bring it. If that's gonna stop you from getting in here, bring that stuff with you, bring the baggage. Yes, sir.
Which kind of reminds me, are pets an issue?
Pets aren't an issue, but what we do is we say, you know, we don't say we don't allow pets, we allow companion animals and service animals. The reason we go that route is because when they get linked to housing, a lot of apartments have restrictions on animals, certain dog types, certain breeds. So we're actually working with our individuals by setting that tone and helping them learn, educate them on how to go about taking the right steps to have a dog as a service animal, or it might be their companion animal, to get the proper documentation. So we actually do, you know, accept individuals with companion animals and service animals, and some of them might not have the paperwork right away. We'll educate them on how to get the paperwork, you know, or even help cover the cost to pay for, you know, their certification and things of that nature.
And people with PSTD, that they need their animals, right?
Exactly, you know, and we don't, and I can tell you firsthand, coming from San Diego, 95% of the individuals, if you tell them their animal can't come, they're not coming. They're gonna, can my dog come? No, okay, have a good one. And then they're not gonna skip a beat. They're not gonna waver, they're not gonna even be like, oh, well, not gonna consider it. And so we wanna make sure that we're removing that extra barrier if it is.
And I think if I remember, you also, if somebody comes in and they have things that they need to take care of, you go on for 2 weeks or a month, take care of a program, and then they have their stuff to come back to in the bed and continue on.
Absolutely. So if somebody's leaving or we tie somebody to a resource like drug and alcohol treatment is one of our biggest ones, you know, they're gonna go to treatment for 3 weeks, 4 weeks on end sometime. We make sure they know they have a space to come back to. It might not be that exact bed because we want to make sure we're fully utilizing all beds. However, your stuff is, we're gonna bag and tag your stuff, we're gonna make sure we keep it safe. And when you get out, it's gonna be there. But more importantly, you're gonna have somewhere to come to when you do get out. We make sure we're committed to doing so. I think it's wrong if we're saying, hey, go away from treatment, go get your, you know, go get A, B, and C. They get out of treatment, they have nowhere to go. They go back to the streets. You know, they go back to the streets are dangerous, I gotta stay up at night, so now they're gonna revert back to using meth or some type of upper to keep them awake at night. When, you know, a lot of our population, that is a good percentage, that's why they would resort to using meth and drugs of that nature, is to, you know, stay awake at night so they don't get robbed or attacked and things of that nature. So, you know, being mindful of stuff like that, you know, I think I've had, you know, my participants sit across from me here and in San Diego, you know, what made you start using, what made you get into this and that? Like, oh man, I only started using when I got homeless, and I only did it to stay awake at night so I wouldn't get attacked. And you know, when you hear that, it makes total sense. Like it makes total sense to where, you know, but it's a sad factor that we know is impacting our population. But yes, we actually do make sure that they have somewhere to come back to if they go off for treatment or something of that nature. We have individuals that actually go, part of us getting individuals linked to their medical benefits, things of that nature, is because we have a lot of our participants who have medical conditions, they're ailing, you know, that if we were to house them before we get that medical condition taken care of, they're gonna die when they get housed. And that's just being all the way transparent. So that's why it's a big deal for us. To the moment you come in, do you have medical coverage? Oh, I don't have. Let's get your paperwork filled out. Let's make sure you're eligible. Let's get you squared away. Let's get you linked to your primary care physician. So that way somebody might go away and get I've had somebody go get a surgery on their foot and they were out for like a week and a half. They were concerned, but they weren't going to get the procedure done because they're concerned that if they got the procedure done, they wouldn't have something to come back to. Like I really want that to set in. I'm not gonna go take care of this medical procedure that I need done that's life-threatening because I'm not sure if I leave, I'm not gonna have somewhere to come back to. I don't want to go through recovery on the streets. So we're literally making it a point to, if it's gonna be a long-term care that they need, we're gonna make those arrangements prior to them going into the hospital. when they go to the hospital, we're gonna reach out to the social worker. Hey, PK just checked in, you're going in for this procedure. They're gonna need this level of care, so we're acknowledging that they're not gonna be able to come back here. They need to go to a SNF or boarding care. By us doing that, we're not saying they're not allowed to come back here, even though that's what it sounds like. It's putting the onus on the social worker and the hospital to do their job. Because now they're responsible for placing that individual in the proper level of care before they discharge them from the hospital. A lot of entities won't know that, to where if the hospital knows, oh, they're in a shelter, you know, they're done with the procedure, we're gonna send you right back to the shelter. When it's, you know, how can somebody really recover from a long-term medical condition in that type of setting with, you know, the vulnerability to, they're more vulnerable to disease and stuff like that when that happens. So we definitely provide that safe space for them to come back to if needed, and or we'll try to link them to a long-term care facility before they get out.
Here's a question from the virtual audience, Mary.
Yeah, you said people can't just knock on your door. I know a few guys who were thinking about starting to not live on the streets and are looking for places. So if they were interested, how would they get started to get a place with you guys?
I'm gonna email it to you, PK, and you, Gary, but it's gonna actually have our website address. It's gonna provide a link. More importantly, for those individuals that do knock on the door, we're gonna provide them with the number and the locations where they can actually go and get a real-time front door assessment to get a referral into our program. So one of the things is where, like, we don't take individuals that just walk in, but we're not gonna let somebody walk away without tying them to a resource or providing them with some type of information on how to get in here.
And what's the time generally between somebody knocks on your door? How long is the process before they can get in, assuming they can?
If they were to knock on the door at 9 a.m. and then we were to give them information to get a front door assessment, which there are different entities that do them, and they were to get a front door assessment that day, their referral would go into the queue by that afternoon, to where essentially they'd be able to get a call within 24 hours for the bed availability if we have it.
Okay, great.
Yeah, when the outreach workers, when they do those assessments, those get into the system and they're active, they're pretty much real time, it'll reflect. Or if somebody said, hey, they came today on, you know, like go get your assessment done, by tomorrow, there's a chance we can actually see the referral in the queue.
So there's not a waiting list?
If we don't have beds available, there will be. But what we do is, so we do have a list of referrals that are pending, and we make it a point to where we call 2 or 3 times, leave a message, no response, we're going on to the next one. We make it a point to where we won't try to track somebody down for days on end, to where we just have, you know, just a bunch of open beds.
Yeah.
We'll, you know, call a couple times, leave a message, go on to the next one, go on to the next one, stuff of that nature. And then we won't deny the referral. So the referral will still be in there.
Yep.
It'll just show that we attempted contact and reached out to them, they just didn't answer. So their referral will stay in there, to where they might not answer this week, 3 or 4 weeks from now, when we call back, they might answer again.
And the last thing I want to also point out is, say somebody is gonna go to the hospital after surgery, do this. It's not just, oh, this week I do, have a nice day. I think the warm handoffs that they do with their providers and their partners is very important for that connectivity.
Absolutely, to the point where my staff is going with, I've had individuals, I've had my staff go with individuals to court. And the person they had some warrants and had some fines that they owed, because my staff was there and they saw, okay, you are part of the program, they're actually helping you work towards this. Everything's dismissed, warrants are lifted, because of the work we put in the program. So just by them being part of in that program and off the street and progressing towards something. That's a huge benefit, because that's, you know, the city and the county's tax dollars not being wasted on, you know, having to jail or house another individual and stuff like that. You know, it's money that they're not. It's money that they're not owing fines on that's preventing them to get more self-sufficient. And it's not money that's building up accumulation and interest that they owe the city or the county, to where that debt's not continuously growing. So yeah, we're definitely huge on warm handoffs. When people come to us and then we refer people out, you know, because we want to give them a voice of advocacy. So it only makes sense for it. If I'm working with Kate, I'm gonna go with you to your appointment. This is what you're gonna be going into, this thing. I'm going with you to it, to where Kate might get extremely nervous and anxious when we get there. So I might have to talk to the person that's doing it and say, and provide that extra layer of support. So that could be our case managers, but now more importantly, our peer support specialists are gonna be actually identified and being doing that. So where they're gonna be able to get that hand holding to wherever they need to get to, and then the warm handoff.
Are there any gaps in the support you get from community? So when I listen to you, I think of things like, well, geez, maybe they would really benefit from somebody who has a lot of bike repair experience to collect a bunch of bikes and fix them up and provide bicycles, or are there like specific things that, or
Exactly what you're saying is stuff like that, which is stuff that like, even what you pointed that out is. Most of our population love bikes, they ride bikes and utilize them, so absolutely, if there is an individual, if you guys have somebody that. Does bike repairs or free bike repairing and stuff like that, we have the space and the capacity to where. They can do it on site, you know, one of my programs, I actually bought a bike repair station. Because one of the participants loved doing bike repairs, and there's an area in San Diego, in North Park. Where they actually put a bike repair station on the corner, and one of my homeless individuals. Would go there every day, about 4 to 5 hours a day, and repair people's bikes in the community for free. Just because that was a niche for them and it was an outlet for them. So even so something that somebody would seem like that small is huge,
right?
you know, so absolutely, we love stuff like that. We're working with the University of Oregon right now. We're trying to get some interns to start coming. And we want, you know, we're going to start having them serve food, start off with that. You know, we have the food that we make in prep, but allowing them to actually serve food so they can get familiar and humanize who we're serving. So, because every one of those individuals in that shelter has a story that you either haven't heard or you just weren't aware of. And I guarantee you, if you spend some time with our participants, like it will hit home. Like there's everybody there has a story that you can relate to, period. You know, and I even I don't care how you slice it and dice it, what color you are, what shape you are, what political party you are. Their story will relate to you one way or another. You know, I've had ranging from former neurologists, the directors of neurology departments in my shelter. I've had children of the presidents of housing commissions in my shelter. I've had, you know, every walk of life in my shelter. So when I say I've seen everybody in my shelter, homelessness doesn't discriminate, you know. And so I think with you guys, where you guys are with this community meeting, you guys are trying to get involved, I think that's huge because us being there, you guys are the reason we're allowed to be there. And I was explaining this to Stacia when I was getting ready to come here. I was like, yeah, sure, what do you mean? I said, community members and individuals that have stake in their community like this, we're not going to be successful without you guys' support. We're just not. We're not. You know, even we can crank out the best numbers, we can have great results, but if you guys aren't confident and comfortable with what we're doing, it's not going to work. And so part of me being here is making sure that you guys trust the process. I'm getting your input, I'm getting your feedback because, you know, I need all hands on deck and I need to hear all voices, making sure that we're doing the right thing, not just saying the right thing, but doing the right things and that the outcomes match the results and whatnot.
What's your last name?
Order.
Porter?
Yes, ma'am.
So that information, I sent all the information, did I send it to you or to Tim?
Not to me.
Relative to the webpage and the, and how to contact Glenn and Keela, one of his assistants. And I can send it to you.
I'm sure that it went to Tim to get on the SACO webpage.
Yeah,
So that's.
because there's really a desire to have the opportunity for anybody that wants to make contact and whatnot. And that's why Glenn indicated the interest in getting on our webpage, having a site there, so they can tell you what they're doing.
I'm really appreciative. I know some more of the story, and I'm really glad that we can have others hear it and then share that message, because it's not what you think, because we all think something different.
Mm-hmm.
To understand what our neighbors are, who they are, what's going on, and I think it's important to understand how it's connected, but all the things that are going in, there's a lot of stuff that's happening, it's hard work. So we do appreciate that, thanks for spreading that.
Yeah, of course, I appreciate it, and I'm glad, even with you saying that, and I want to emphasize that. I'm making it a point to where we're at and what we're doing, we're not gonna be a dumping zone for people that don't get serviced. We're making it to where people come there and they're getting the help and the treatment and the resources they need. Like, we're not letting individuals come in there and just be idle and just, no, I'm just here to go to, no, you're here to work towards something. Even if you're not ready just yet, we're gonna continuously work with individuals to make sure that they get to a certain level stage of change and get to where they want to be self-sufficient and an individual that's not just taking from the community, but they have input and they're putting back into the
Great,
No problem.
thanks a
There you go.
lot.
Thank you.
Yeah.
Thank you so much.
You know, it occurs to me, if you think of certain things or volunteer type things you need, we do mailings to our neighborhood. Try to do 2 newsletters and 2 postcards a year, and so if you have specific things, items or volunteer positions, you could let us know and we can put it in our newsletter and maybe help get the word out.
I can try to start sending you guys maybe a success story once a month or something.
That would be
Good.
great.
Because a lot of these individuals we serve are, what I've been learning, they're friends of your kids, they're friends that you know, these are people that you went to school with, and I've had people in the shelter that I went to school with, and I hit home, because it's like, you know, if it's a shelter in your community, some of those individuals you will know, you know, at some point in your history, if you've been here long term, you know some of those individuals that are in that shelter, so they are really, like you said, our neighbors.
All right, thanks.